From WREL News and the Capital Broadcasting Podcast Network, this is your Coronavirus North Carolina News Brief for Wednesday, July 29th, 2020. I'm Cliff Baumgardner. Here's the latest from WREL.com. The North Carolina State Fair has been canceled this year due to concerns over the coronavirus. State Agriculture Commissioner Steve Troxler said the department surveyed fairgoers from previous years to find out if they would attend this year's event. Only a third of those surveyed said yes. At a press conference today, Troxler said of the cancellation, quote, "We waited as long as we could, hoping the numbers would take a turn and we'd be able to continue with our planning. But each day brought more challenges than solutions." The fair was scheduled to take place October 15th through the 25th in Raleigh. Despite the fair's cancellation, there will still be junior livestock shows and horse shows in October. Troxler said to expect more drive-through state fair food events at the fairgrounds, which have proven to be popular. Officials said the decision to cancel the fair now would help ease expenses. The fair costs about $6.8 million annually to produce, with many contracts that have a 60-day cancellation policy. The 60-day window for the NC State Fair would have been August 16th. The state fair attracted more than 938,000 people over its 11-day run last year. This would have been the 153rd state fair. The cancellation is the first since World War II. Recently, two other events, the NC Mountain State Fair in Fletcher and the Carolina Classic Fair in Winston-Salem, were canceled as well. Yesterday, Governor Roy Cooper said he's implementing a statewide restriction, ending all alcohol sales for on-site consumption at 11 p.m. nightly, starting this Friday. Cooper said evidence from a number of states has shown bars to be sites of viral outbreaks. Bars have been closed in North Carolina since March. And he said some restaurants in North Carolina, quote, essentially turn into bars late at night. Restaurants statewide were limited to takeout and delivery orders from late March until late May, and they are still required to operate at half capacity after investing in plastic screens, masks, sanitizer, and other protective gear to help keep customers and employees safe. Cooper said the restriction on late-night alcohol sales is especially important as universities reopen across the state in the next few weeks, bringing tens of thousands of students to North Carolina from across the country and abroad. The executive order doesn't affect sales of beer and wine at grocery stores and convenience stores, but it does apply to catered events where the alcohol is served for on-site consumption. Local law enforcement, state ALE agents, and the State Alcoholic Beverage Control Commission will enforce the sales prohibition. Violations are a Class 2 misdemeanor, but the ABC Commission could also take action against violators' liquor licenses. The statewide action follows similar moves in Raleigh and Orange County in recent weeks. Because both of those ordinances are stricter, the executive order won't affect them. And lastly, some nurses at UNC Hospitals say they believe patient safety is on the line due to a new policy. Two nurses said they and many of their colleagues are being rotated into different units of the hospital complex with little training. A pediatric nurse said she thinks the policy presents, quote, huge safety issues. Nurses gain specialized skills by working for years in specific areas of a hospital, she said, noting that she understands children's health, not so much about adults. A second nurse agreed. She said the lack of training and a lower standard of care could get them in trouble with the North Carolina Board of Nursing. The nurses also said they were concerned UNC would not protect them or their nursing licenses should something go awry because of the policy. UNC Health spokesman Alan Wolf acknowledged the rotation policy, saying it was implemented because of staffing pressure caused by the coronavirus pandemic. But he denied that nurses were being put in position to fail by treating patients without training, saying, quote, some of our nursing staff has had to cover areas where they may not routinely work in order to provide safe and excellent patient care. UNC Medical Center's clinical and nursing leadership has put programs together to assist nurses in preparing care for these patients. Wolf said if a nurse feels uncomfortable with an assignment, he or she should notify a supervisor and request more training. But the nurses said they presented hospital administrators with some 20 pages of documents outlining their concerns and questions about the policy, and a planned meeting on the issue was canceled. The nurses also expressed concern about caring for COVID-19 patients and then having to return to their normal duties caring for patients who aren't infected, some of whom may be at higher risk for coronavirus because they have weakened immune systems. Wolf said all nurses are given enough protective gear to ensure they and their patients will be safe. This has been your Coronavirus North Carolina News Brief for Wednesday, July 29th, 2020. As always, if you enjoyed the news and information you get from this show, let us know. Leave a rating and review wherever it is you listen. Plus, while you're there, don't forget to subscribe so you don't miss our new episodes. And on that front, we have an update. Going forward, the News Brief will be posting episodes on Monday, Wednesday, and Friday. This frees up more time for us to produce great content and information on these important topics. Our next episode will air this Friday and then 3 days a week going forward from there. As always, thanks for listening.